Hello, you're very welcome back. Now, if you Google search your symptoms as soon as you're feeling under the weather, then you might be a cyberchondriac.
Yes, this is something that a lot of us are guilty of, but it's a very real condition. And here to give us some insight into this is cyberpsychologist Dr. Nicola Fox-Hamilton and pharmacist Sheena Mitchell. Good morning to both of you. We were just discussing this before we came on air. I'm a total hypochondriac. All my friends, even Mirren, slags me for it all the time. But I never turn to Google. But what is this? What is a cyberchondriac?
So cyberchondria is actually more of a symptom than an actual condition. So it's not a disorder, it's not in any of the handbooks that identify disorders, but it's a symptom that's related to some other disorders, very much related to health anxiety or illness anxiety disorder, which is what we call hypochondria now, to obsessive compulsive disorder, and also to problematic internet use as well. So it's basically where you have excessive worry about your health that's not related to actual symptoms, and you start to compulsively and excessively search for health information online to try and reassure yourself that things are okay. But instead of feeling relief from it, you actually get more anxiety, partially because you're processing so much information and poor quality information. And it can just lead to more anxiety and an escalation of your anxiety. And then you turn to more searching and so on. So it can become a kind of a vicious cycle.
Okay, and so I'm sure everyone out there Googles their symptoms now and then. So how do you identify that you have this cyberchondriac syndrome?
I think very simply, if you search for your symptoms online and you feel relieved or not very anxious afterwards, you don't really have a problem, because loads of us search for our symptoms without any issue at all. If you come away from it feeling more anxious and feeling like you need to do more searches, or you need to continuously go to your doctor and search and search and search, that's when you've maybe got an issue. I think most people with health anxiety kind of know that they have it. They constantly worry about things with their health. If something minor happens, they catastrophize it a bit. If you feel like that, then you're better off not searching online. You're better off actually talking to your doctor and developing a good relationship with your doctor instead.
And I suppose at the moment there is, like, we all know about the waiting lists. I mean, I was trying to get bloods and it was like, I could get bloods 3 months' time. I was going, oh my God, 3 months. So, I mean, Sheena, as a pharmacist then, do you see that people coming in, they went, I have a sore throat and I Googled it and and they start saying, I have this or I have this, and they obviously don't. They might just have a sore throat.
Yeah, absolutely. And what I would say is it works both ways. And I think you hit the nail on the head there. There's a lot of issues compounding this problem. So people aren't able to access healthcare. And that's something, you know, I'm a big advocate for accessible healthcare. And so people are turning to Google to try and, I suppose, do a bit of the homework themselves to avoid doctor visits. And then even when you look at the financial situation.
I suppose that, like, it's €65 to go to a doctor, and you could go to your local pharmacist and go, I'm after looking at this on the internet, I think I have this, what do you think?
Exactly, and if it's a choice between, you know, feeding your family for the week or bringing one of your plethora of children to the GP, you know, if they're 9 or 10 and they're not covered. But what I would say is that caution is always needed. What we find commonly coming into pharmacy, and this is really, really why it's important to seek medical attention, including pharmacists as healthcare professionals. So people will come in and say, I've got this dry, tickly cough, and they've been maybe self-treating with cough bottles, and they've been doing this for several weeks on end. They could have maybe an underlying stomach ulcer that is worsening because of the medication they're taking. And when we chat to them in a community pharmacy level, we suddenly find out, we'll ascertain their medication that they're on and go, well, actually, you started a new blood pressure medication, for example, and one of the side effects that can happen with that is an irritating, persistent dry cough. So they're treating something...
It's just a sign of something else, or it's an effect of something else they're taking. But, like, Sheena, can I ask you then, because if I go into my pharmacy, the pharmacists are under an awful lot of pressure as well. And I don't think it's the same now as the days when you could go into the pharmacist and talk to them, because they just don't have time.
I'm going to disagree and agree, because you're right, we are busy, we're under pressures, we're under a lot of bureaucratic nonsense that I won't go into today, where, you know, we're overburdened with pointless admin, and we'd much rather have more time to be out with our patients. However, on the flip side, 2 things. First of all, every pharmacy in the country has a private consultation room. We'll all have seen that from where we rolled out all the vaccinations really efficiently. The other thing is, it's not just the pharmacists that are in pharmacies. We have trained counter assistants, technicians and other people who are absolutely trained in over-the-counter medicines and the treatment of minor ailments. So while you mightn't be always speaking to the pharmacist, the likelihood is you are trained with someone who is appropriately educated to be able to respond to your symptoms. And what they do, we train them to flag, so they'll be aware of warning symptoms that they then come to us with, and if the pharmacist is needed, we're always available, you know?
Yeah.
And Nicola, so you mentioned there about health anxiety. So I don't think that's anything new, but I think with the rise of maybe misinformation on social media that it's become massively increased.
Yeah. So one of the things that can increase health anxiety is having to process the amount and poor quality of information you find online. So we know that the vast majority, in fact, of health information online is actually very poor quality. It might be misleading, there might be information missing, sometimes it's just completely plain wrong. And so ideally people would be going to sources, things like the HSE, the NHS, you know, good quality sources. Ideally they'd be guided by their doctor or their pharmacist to the good sources. A lot of the time that's not happening. Patients are doing it on their own. And so having good quality sources is really, really important. And also having an awareness that when you search for information online, the algorithms are pushing certain information.
Yes.
So the things that people click on most are the things you're going to get most.
Yeah.
So if you search for headache and you see brain tumor, you're like, oh my God, and you click on that. And so of course that comes up more. So there's this bias towards very catastrophic outcomes, and that can increase health anxiety as well. So it's having an awareness of that is actually helpful. So one of the interventions that's quite useful for reducing cyberchondria and health anxiety is teaching people about the problems with online health information, teaching them how to find neutral sources and to avoid catastrophic thinking, because you know the catastrophic outcomes are very unlikely in comparison to things like a headache.
And go to places like the HSC because they have the proper information.
Yeah.
Are there any positives at all from going online with? Because I know you could find support groups maybe for someone like if you have an eating disorder or something like that, that you might actually find a support group that could help you.
Yeah. There are huge positives to it. So one are the support groups. The other is that searching for information about your health online actually leads to better doctor-patient relationships, particularly when the doctors are open to having those conversations. But support groups are immensely helpful to people. They have some negatives as well. Sometimes the quality of information isn't as good. But finding people who have the same experience as you, particularly if you're newly diagnosed, can give so much social support to people. It reduces loneliness, anxiety, depression. It can be immensely beneficial.
Well, I tell you, it is something that as I said, I'm a hypochondriac, but I've never gone on Dr. Google because I do think it is a dangerous place, and it is something that we will obviously discuss again. But thank you very much for coming in this morning. That's Dr. Nicola Fox-Hamilton, who's a cyber psychologist, and Sheena Mitchell, who's a pharmacist. Thank you so much for coming in.
Thank you.